The A1C number that you were given by your doctor might be wrong, and in this video, I'll tell you why and what you can do to fix it. Hi, I'm Sam. I'm a third-year family medicine physician. I see patients in the hospital, in the clinic, in the emergency room, and sometimes even in their homes. I've seen thousands of A1Cs from too high to too low to just right. First, let's define what is hemoglobin A1C. That's the full name for the A1C test for diabetes. The hemoglobin A1C shows your average blood sugar level for the past 2 to 3 months. An A1C test can be used for two reasons. So it can be used to diagnose diabetes, or it can be used to see how well diabetes treatment is working. Let's first talk about what's a normal A1C. So a normal A1C is an A1C less than 5.7. So that's normal. And the next category is when you start to get insulin resistance. So you are pre-diabetic in this next category, meaning that you're at risk for developing diabetes sometime in your life. That's the pre and pre-diabetic. So this is an A1C of 5.7 to 6.4. Anywhere in that range, you're pre-diabetic and you're starting to get insulin resistance, or IR. Your body's starting to require more insulin, it's starting to have higher blood sugar, and you're getting more at risk for diabetes. So the A1C value for diabetes is anywhere from 6.5 or higher. So that would tell you that you have diabetes. And it's important to note, if you get one value and you get a new diagnosis, I would strongly recommend repeating that and making sure that the diagnosis is correct and not just a lab error. So for people that have been diagnosed with diabetes, they often get an A1C goal. So let's talk about that. And let's box in this category of diabetes. Their A1C goal is usually 7.0 or less. And this can change based on age or based on specific medical conditions, so it's important to talk to your doctor about your specific circumstances. As I mentioned in the beginning of this video, A1C is actually called hemoglobin A1C. Therefore, anything that changes hemoglobin can give you a false A1C number. Hemoglobin is the part of your blood cells that grabs onto oxygen and brings it to every part of your body. So anemia is the word for low hemoglobin, and this can change your A1C if you have this. Your A1C can be incorrectly low if you have low iron or chronic kidney disease that causes your low hemoglobin. On the other hand, your A1C can be incorrectly high if you have low vitamin B12 or low folic acid. Most people want to know how to lower their A1C to their goal. So if your A1C is 10 or more, then you might need insulin. And it doesn't have to be a permanent medication that you take, but you might need to take insulin for some time to get you out of that cycle of high blood sugar. So that would be for an A1C of 10 or more. And then if your A1C is 6.5 to 10, then you can do what we'll call lifestyle changes. So that's diet, that's exercise, that's cutting out the sugary drinks, that's cutting down on the carbs, that's making a goal of exercising daily. You might be able to get your A1C to your goal by those lifestyle changes. Diabetes medicines might help as well, so talk to your doctor specifically. If this was helpful to you, consider giving this video a like and subscribing, as I'll be sharing more tips to live a long, healthy life.